my initial reaction when I heard about the flood was one of, wow, I need to see what's personally going on. So at that point I was actually in the south structure parking garage and witnessed about probably close to a foot of water just barely encroaching on the bottom of the cars, and I knew we were in trouble.
So she and the key leadership immediately responded, and their first concern was the well-being of the patients. What kinds of things did they need to do immediately to be sure that the patients were taken care of?
When I first came down to the emergency department, we had, when I opened up the stairwell door, we had water, it looked like kind of like a river rushing through the emergency department.
All the nurses, all the paramedics, the secretaries, all the staff here in the emergency room just sprung into action.
We had 70 patients in the emergency department, and they were evacuated within 17 minutes. When you think about that, that's about a patient every 15 seconds. That's probably the greatest accomplishment that this department could have ever done.
Yesterday, 2 hours after my shift to help, because this is, I love working here. Everybody came together. It was like a family. It was unified. We have to help. That was the bottom line.
This is a fairly busy hospital with a busy emergency department. We service a fairly large area. Many of the other hospitals were also inundated with floodwaters as well. And we've always been there for our community. And this was a very difficult time. And I saw the people in the operating room come together and provide above and beyond what would have been expected of them to see to it that indeed patients do come first at Oakwood.
We had many staff and many physicians stay here overnight. Many of them pulled double shifts. Many of them did things outside of their normal job descriptions. Many of them pitched in ways that far exceeded what would ever be normally expected of them. Just phenomenal support and friendship and teamwork just abounded throughout the process.
I don't know how to... Look at the truck. My feet are soaked. You're going to go through there?
No, I'm going to go down to ER and walk down the stairs.
So their office is soaked.
Oh, well then,
they're all wet.
I'm going to cancer center.
All the physicians were very responsive, and not only the physicians, but mainly the nurses, the nurse practitioners.
As a new director here, I had been with Oakwood Health System for about a week. And coming into it with the new flood, it was just unbelievable on how everybody said, what more can I do for you? They took the time, they lived the credo, they lived by example, and it was just overwhelming in how I felt with the support that I had from all of the members in this hospital, including my own staff.
This isn't a job, it's more of a commitment, it's more of a vocation. And over again, our employees wanted to be sure that the patients came first. So the mayor, the governor, and the congressman came, and they toured the facility, and they were really shocked. They had no idea that the flood was as bad and had the consequences that it had. But the relationships are really important, because when we called, they came.
And it was important to tour here in terms of Oakwood. It's a tremendous community asset that suffered awful damage. And I really want to compliment for their response times. To get back up and operating as quickly as they did, taking care of patients, they're really to be complimented.
Well, the thing that came to my mind as how everyone stepped up to the challenge, how members of the housekeeping and plant ops went out of their way to see that everything was as good as it could be.
The effort for the cleanup from the flood was monumental. Typically, we do about 300 to 400 instrument sets per day in our sterilizers. Because of this disaster, we ran almost 3,000 instrument trays in a 4 to 5 day period.
How we were able to continue to provide food service to our patients when we didn't have an elevator. We had over 100 people come together. We had a human elevator, a human pass-through. Everybody went up, brought the food up the stairwell just to make sure our patients received a meal.
It was very nice to see everyone work together and get everything back together as fast as they could.
The new state of normal at Oakwood Hospital Dearborn continues to be every patient, every time as being our #1 priority. Patients come first, plain and simple. So that never wavered before, during, or after the disaster. It's a lot of work to do. There are many codes and regulations we have to follow relative to making sure everything's dry and safe and disinfected and sterilized. And then we can go around the business of renovation, reconstruction, new furniture, all new supplies.
We've got a plan, and the people are committed to making it happen, and I think as quickly as possible we'll be back having this area completely redone. And I guess the good news is there's some things that we might want to do a little bit differently. So there's some flow issues, patient flow issues, and some waiting areas and some amenities that, since it's all torn up, we may as well put it back together again and do it in a more modern, more current fashion.
The team responded perfectly. I couldn't have been happier with how quickly, professionally, and expeditiously everyone just went into action. I didn't see anyone who didn't know what to do. It was really phenomenal that everyone kept a smile on, put patients first, never forgot about safety, and just went into action. It was something to see.